The daily COVID-19 positive cases for the January period are in double digits. The figures show 39 cases registered on 24th, 73 on 25th, and 53 on 26th.
It's not the entire month, but the cases were not very many compared to what took place in December. So far halfway January, because it's not the entire month.
December 2020 was listed in the peak period. Declared daily cases in a 3-day sample during the election campaign showed that COVID-19 cases hit 445 on 24th, 203 on Christmas Day, and 248 on 26th.
It was an increase in cases by 24% since December, meaning that probably because of the activities that were taking place during that time.
The effect of the reduced cases in January manifested an availability of hospital beds. The numbers of patients in the health units at one point reached the brim.
Like Mulago, occupancy is currently around 30%. So the numbers are now manageable.
However, it may be too early to jubilate. Majority of the tests conducted are on individual initiative, unlike at the onset of the pandemic in March, where random community tests were carried out. Authorities say they intend to obtain a realistic picture of the situation.
We intend to do a countrywide sero survey for COVID, which will be able to ascertain the intensity of the disease and also the prevalence.
An exact date for the random testing in 30 districts, including Wakiso, Gulu, Pader, and Arua, is yet to be appointed. On Monday, the cabinet resolved to borrow $31 million from the African Development Bank towards strengthening response to COVID-19.
Scale up laboratory testing and diagnosis by at least 5% through provision of testing kits, consumables, and accessories, to strengthen the current ICU capacity with at least additional 140 ICU beds.
Government expects to receive the first batch of the COVID-19 vaccines for 9 million people in April. The cost for this is $164 million. Prioritized beneficiaries are people faced with a high risk of severe disease and death. Older persons, estimated at 3.3 million, are included on this list. Jackson Onyango, reporting for NTV.